Turning now to NBC5 Investigates with a follow-up story to a story we first brought you earlier this week. U.S. Senator Tammy Duckworth says she has reached out to the VA, expressing concerns raised by veterans that the VA is now limiting their mental health care.
Now, while the VA denies this, our NBC5 investigation found veterans and VA psychologists across the country have complained that it is, in fact, happening. Let's get to Bennett Haeberle tonight with a follow-up to the story that you brought us.
Yeah, Allison and Stefan, no shortage of feedback on this or concern. Since our story first aired this week, I have received several emails and phone calls, talked to more veterans and psychologists who say they have experienced this too.
The VA's official statement is that there is no VA directive or memorandum that mandates psychotherapy caps or session limits. But veterans and psychologists across the country told us there is a disconnect between what the VA is publicly saying and what is happening on the ground. Veterans and psychologists from Chicago and at least 4 other states tell us that the VA has made changes to internal performance standards for psychologists that tell them to limit therapy sessions to 6-month episodes of care, or 20 to 24 sessions. The vets we spoke to say this is concerning to them. They worry it takes several sessions for people to open up and that they have complex needs. We spoke to Senator Tammy Duckworth, a veteran herself, who sits on the VA committee. She tells us she has asked the VA for answers as well.
It very much deserves a deeper dive. And in fact, it's deeply troubling that psychology, what they're calling performance standards, quote unquote, at Jesse Brown and at VA medical centers across the nation have been quietly changed. They've been doing this all over the country under new internal policies.
And Senator Duckworth tells us that she is asking the VA to justify why these changes have been made. By the way, the American Psychological Association says that many people could certainly be treated in 15 to 20 sessions, but it also states there are others who require longer treatment, perhaps a year to 18 months. Again, of course, there's pushback from the VA, who says there is no limit. A spokesman referred us back to their original statement, and the vets and psychologists that we spoke to say they are seeing this happen. And Allison and Stefan, we continue to hear from them.
So much concern for our veterans, especially regarding mental health and PTSD. Yeah. I mean, this is a huge topic.
And a perennial concern also with suicide with vets.
Suicide.
Yeah.
Right. Thank you so much, Bennett.
Thank you.
Sure.